Raluca, and today I'm going to go ahead and demonstrate on how to insert an NG tube. Our patient's name is Mr. Smith, and he's getting a tube for suction purposes, just to make sure we have him ready for surgery. We don't want any aspiration happening. So the first thing we're going to go ahead and do is start with standard protocol by checking the doctor's orders. We want to make sure that we have the right patient. We want to make sure we know the purpose of the NG tube. And like we said, it was suction purposes. We want to know what kind of tube the patient is getting, and since we're using it for suction purposes, we're going to do a 12 to 18 gauges NG tube. And after doing that, we're going to go ahead and enter the patient's room. Hello, how are you doing today?
Doing well.
Alright, well, my name is Raluca. I'm your student nurse. And can you say for me your first name, last name, and date of birth?
It is Mike Smith, 4/18/73.
Alright, thank you so much, Mr. Smith. And today we're going to go ahead and insert an NG tube so we can get ready for your surgery upcoming, okay? We don't want you to aspirate during your surgery. We're going to go ahead and inspect the patient's nares. I'm going to go ahead and do hand hygiene, and also I'm going to go ahead and apply my gloves. Alright, and now can you go ahead and breathe out that nostril for me? And the other one? Alright, I'm going to use my pen light to check for any deviances, any surgeries, anything that would get in the way of the NG tube. And I see this nostril is a little more patent, so we're going to go ahead and insert the NG tube over there. Next thing we're going to go ahead and do is we're going to measure the estimated length of the tube. So what we're going to do is we're going to start from the tip of the nose, work our way back to the ear, and then we're going to go all the way down to where we think the xiphoid process would be. We would then go ahead and get a piece of tape and put it on so we know approximately where tube should go in. Okay. Let's get another one. Alright, perfect. Okay. Now, we're going to go ahead and we're going to start the process. So now we're going to go ahead and we are going to let the patient know, Mr. Smith, if you don't mind, just put your head backwards. And we're going to go ahead and apply it in the water. And then we're going to go ahead and lubricate it with jelly, 4 inches deep. Alright. So now we're going to go ahead and also apply a towel over the patient just to make sure that we keep him nice and clean. Okay. So we're going to go ahead and tell the client the insertion is starting. We're going to have him extend his head back, and he's going to be in half Fowler's position. We're going to start by inserting the tube slowly through nares, curve and down towards the ear, and we're going to apply gentle pressure if resistance is met. By the time we reach the throat, we're going to check for coiling. So, Mr. Smith, let me know if you need a gag or anything, okay?
Okay.
Alright, and now we're going to go ahead and check for coiling. And there's no coiling. We're going to tell our patient to go ahead and bend his head forward, chin to chest, while he's taking sips of water. Let me know if you need to gargle or if you need to, if you feel like the NG tube is bothering you. Alright. And we want to go ahead and keep doing this while the patient is drinking water. And then we're going to go ahead and advance the tube with each swallow. If gag or cough happens, withdraw the tube a little bit and then let the patient rest, and then continue until we have reached the tape. When we're done with that, we're going to go ahead and tape the tube to cheek so we can check for placement. Alright. First thing we will do is we'll ask the client to speak.
Hello.
Alright, so the patient can speak. We already inspected the posterior pharynx for coiled tubing. Now we're going to go ahead and attach the catheter tip syringe to the tube and aspirate. And while I'm doing that, I'm going to be using my stethoscope to listen for gargling. So the first thing I'm going to go ahead and do is I'm going to aspirate. And I'm going to observe for color, brown, green. If the hospital would need it, if it would be policy at the hospital, we would check the pH. Now I'm going to go ahead and re-inject the aspirin and listen with my stethoscope over the gastric area for swishing sounds. Alright, as swishing sounds were heard. The best way to actually check for placement of the NG tube would be a chest x-ray, but we would probably get that done as soon as we finish the whole placement. Now we're going to go ahead, we're going to take 10 milliliters of water. I meant 30 milliliters of water, I'm sorry about that. Okay. Alright. We're just going to go ahead and insert it. And then we're going to aspirate it back, just to check for placement. Alright, everything looks perfect. And then we're going to discard of that. We're going to go ahead and anchor tube to nose with tube fixation device. Since we don't have that right now, I'm just going to go ahead and use a piece of tape over the bridge of the nose. And I'm just going to take a piece of tape that is cut in one shape. And then I'm going to attach it both ways. Okay. Now I'm going to go ahead and get a fastened rubber band and then a slip a knot pin to gown. I'm going to allow enough slack for movement, and I'm going to make sure I keep the head of the head elevated. Go ahead and get rid of this. Now I'm going to go and make sure I provide oral care for my patient every 2 to 3 hours for standard protocol. I'm also going to go ahead and document everything. I'm going to indicate the time and insertion of the NG tube, the length size, the type of NG tube, the color and consistency of drainage. I'm going to go ahead and also document the client's response to the treatment and the instructions given. I'm also going to go ahead and attach the NG tube to the suction source on low emitment setting. Alright, there we go. And also for documenting, I want to go ahead and document my intake and outtake to record the number of drainages, and if needed, protocol by the hospital, I would record the pH of the drainage. And that's it.